right, everybody. Hello, this is Patrick Chansey. This might be a while since the last time I've seen some of you. Wanted to get our class started today. I got an exciting topic. So what we are going to be focusing on today is a new technology, something that you may have already talked to your clinic about, and it's a new product that we're pushing that's called continuous glucose monitoring. And really, it's a revolution in how we're testing. We talk all the time. You hear me talk about testing and how are we testing properly? Are we testing enough times? And I know in the back of your head, you're always saying, Patrick, I don't like testing. I don't like pricking my finger. I don't like cleaning up. I don't like keeping up with all the supplies and having to get it out multiple times a day. I don't like when my doctor tells me to do it and wanting me to bring all these numbers back. And the meters have gotten better over the years, but we still have to prick our finger, and it's always painful and it's annoying, and it's never fun. It's always the most despised part of this process. And some of you do a great job with it, others don't, and it's understandable why. It's very difficult to maintain the pace that we need to get all the information. So you have probably heard of CGMs before, or continuous glucose monitors, like I mentioned, but basically it's the next step in testing. So it's the next step in us, how we test our blood sugar and getting all the necessary data that we need to make the decisions that we need to make. And so today I want to walk through, you can already see up on the screen, the actual meter that and it's hard to see it because it's hard to find the meter. I'm putting that in quotations that we're going to be talking about today. So if you're with the Langdale program, this is the specific meter that we are using that you're able to get for free through the clinic. If you're visiting us and not a part of the Langdale company, there are multiple different products that are available. Some are covered by insurance, depending on who you use. And it's really a great tool that I'm excited to talk about today. So let's kind of take a step back and say, all right, so what's the difference between pricking my finger and then whatever this service is? Well, using this, you actually don't have to prick your finger to get a test reading. And like the name implies, continuous glucose monitoring, it's actually monitoring all the time. So it's getting data all the time. Okay, so we're always looking at these different data points and seeing how this works over the course of the day. So whereas you may have been testing once a day, twice a day, maybe even 3 times a day, what if you could know every single moment throughout the day what your blood sugar was and never have to prick your finger? That's what these CGMs provide. Okay, so let's talk about that. So I'm going to pull up our first picture here. So if we look here, we see this. We can actually look right here. I'm going to zoom in for us. We can see this this young lady has a Freestyle Libre 2 sensor attached to the back of her arm, and she's actually holding the reader there. You can actually also use your smartphone. So if you have an iPhone or an Android, you can actually do the same thing with that. And what she's actually doing is she's resyncing the sensor with her reader and getting a current glucose reading. Okay, so she's actually just tapping it to it. So imagine just tapping your reader to your sensor instead of having to prick your finger to get a drop of blood every time. So that's what we're looking at here. Okay, so it provides real-time glucose readings throughout the day and night. It's a small wearable device. So you see that tiny sensor, that little white sensor there, looks about the size of a little bit larger than a quarter, and it replaces the finger stick of traditional blood glucose testing. And so what you're seeing here is what it actually looks like. So we actually apply this sensor. So we apply it to the back of our arm, and after an hour, we start to get data. Okay, so there in that hour, it's calibrating, it's starting to read, and so it's starting to get that data. So we're actually able to see throughout the course of the day what our blood sugar readings are. So you may check at a time that you actually have a good reading. Well, an hour later, something may have happened where your reading is super high or super low, and you don't know because you didn't test during that time. Or you test too early after eating and it gives you a mixed signal, or you test too late. There's a lot of variation, as you know, when we test our blood sugar. And so the sensor is collecting it all the time. Okay, so these sensors last 14 days, which we'll talk about, but you just apply the sensor, it gets started. Just as simple as that. I've helped a few people apply theirs, and because it's kind of intimidating first time you do it, and and when I tell them that we're done, they kind of look at me and say, "How? I didn't realize it was that easy," and it really is simple. We'll talk about that in a second. So we apply the sensor, we start collecting data. So that sensor is going to collect data for 14 days as long as it doesn't come off your arm. So use your reader or your smartphone, like we say down here. So once we collect the data, it's going to start measuring the glucose levels at regular intervals, and it keeps track of that so that you can better see those trends. And then you just use your smartphone or your reader to see what the readings are. And so instead of getting just a couple of data points throughout the day, we're actually able to see all across the entire day what our measurements were. So why would we want to do something like this? Why would we want to use a CGM? What are the benefits here? The biggest benefit is no finger sticks. You can see this young lady out in the yard watering her garden. She's out there doing yard work, exerting herself. You can actually use this while you are showering, while you're. So a lot of people are concerned that if they're showering or swimming, or a lot of people like to swim, we're getting close to summertime, and it's going to be swimming season. And if we are concerned that our sensor is going to come off, that's what they're designed for. They're designed to stay on during physical activity, because you hear me preach about it all the time. We need to have that physical activity, even on the job site. There might be physical activity that you're doing there. This sensor is designed to stay on. There's a strong adhesive that is on the backside, and we'll kind of see that application here in just a little bit. But it stays on, and the sensor then starts reading. And so even as you're swimming and doing these things, doing your exercise, sweating, it's going to stay on. Okay. So, and I'm going to reiterate this. This is gathering data, and we're not having to prick our finger. It's big time. This is a big deal. Okay. So we want to make sure that we keep that in mind by using this new technology. We don't have to prick our finger near as often as we used to. Okay, there are some situations where you may still need to prick your finger every once in a while, but on a daily basis, this is a huge step up. So if you've never liked sticking your finger, CGM with the Freestyle Libre 2 is the way to go. What it also does too, so if we look, so that was our first benefit down here. If we look at our next benefit, is to see the trends and the patterns to help us better manage our diabetes. So the trends and patterns, we're basically able, if we only get a couple of data points, we are not getting a full picture. You guys have heard me talk about a blood glucose reading whenever we prick our finger is like a snapshot. And you can get a lot of snapshots over the course of the day. The more snapshots you get, the better idea you have of what your blood sugar will look like. But none of us can, we can't prick our finger every minute of every day to try to get a better reading on what our blood sugar is. This sensor allows us to do that without having to prick our finger. Okay, so we're actually able to watch the trends. So maybe we can see when our blood sugar was really high or where it dropped really low. And we may not have noticed it at the time, but we know whether you've discussed it with our health coaches, with Dana or Melody, or anybody at our pharmacy team, or if you have talked with your doctor, you know where your blood sugar level should be. And you can see how often was I out of range, out of the range that has been prescribed by my provider, or with the conversations that we've had. So it allows you to see that without pricking your finger. And then you can get an idea of, okay, that meal actually really threw off my blood sugar readings, where the meal that I had for breakfast did not, or the meal that I had for dinner, or that meal that I had for dinner, it kept me elevated all night long and I may not have noticed it. So that's a big deal, to be able to see that information and then realize, okay, what do I need to do next time to adjust? Maybe I need to do my portion controls that we talk about. Maybe I need to increase my exercise. Maybe I need to adjust what was on my plate. Maybe I didn't realize I had as many carbs as I did, or I shouldn't have had that dessert so late in the evening. And we all know who we are. I've got that sweet tooth as well. So huge benefits coming from us using this CGM, okay? So CGM, I'll say that every now and then, but that's continuous glucose monitor. So that's what I'm talking about here. So it's FDA approved, ages 4 and up. It gives us real-time glucose alarms. So as we're syncing this data and bumping it up against our sensor, taking our phone or our reader, it's syncing that information. And what it's able to detect is if there's a negative trend or a trend going up over the course of the day, and there's no sign of it coming down, we can actually set alarms in the system to alert you that your blood sugar is getting too high or your blood sugar is getting too low. So we're able to actually set that. You can set it to whatever you want in the system, and it sends you a notification to say, hey, we need to do something. We need to try something out or do something different. Maybe once you realize your blood sugar is going up, did you actually take your medication today? Did you eat something that you shouldn't have? These notifications are something that we wouldn't have if we were just pricking our fingers. So it's a very big deal to be able to have, just like you get a text message from somebody, you can get a notification on your smartphone. Can be a life-saving situation. And that's a big deal. 14-day accuracy. So this sensor stays in your arm for 2 weeks. So you get 2 per month, 2 sensors per month. That's all you need. It's a little quarter plus size sensor that goes on the back of your arm, 2 of them for an entire month. Think about how many test strips you would normally have to use, or how many lancets you would have to use, because you guys hear me talk all the time. You don't need to reuse your lancets because it gets dull. It's not as effective. You may have to prick your finger multiple times with a dull lancet. It's more painful. There's a lot that adds up to it. Okay, and it's just this little sensor. All you need is 2 of them, and we're going to look at how to apply those here in a little bit. But that 14 days is a big deal. As long as it stays in your arm and is applied correctly, it's going to last for 14 days. And that's pretty exciting. Scan and go. So where we used to have to get out all of our supplies, do a quick check, maybe a lot of times we might not have been cleaning our injection or our finger prick site like we should, or where we're getting our blood from, or where we're pricking our fingers at. We also get those calluses on our fingers. Now you just take your phone, and once you take your phone, you hold it up, you open the app, and you just bump it to your sensor, or you take your reader and bump it to your sensor. That's it. You get a reading, and it will pop up on your phone and show you this is where your glucose is at this time. So it's kind of hard to believe, but that's the way it works. And it looks just like this on your phone. So if you have an iPhone or an Android, like I said, this is what we're seeing. So let's zoom in a little bit and see what this looks like on our phone. So similar to how if you're using a meter that keeps track of your readings throughout the day, it can give you kind of it can show what has happened over the day. This actually gives us much more detail. Okay, you can look on the left, we see what our what our blood sugar is, and the bottom x-axis is over the time, so hours over the course of the day. So you can see where there might have been a bump because of a meal, or you might have had a bump because of something else. So there's a lot there to be mindful of. So this actually gives us a better reading reading over the course of a day to know what our sugar is. We can actually add notes throughout the day. What did we eat? What happened? Did I exercise? Did I forget to take my medication at the normal time when I normally would? So it really, really varies, but this takes the question, the guessing out of it. This actually tells us, we can see what happened throughout the day, and it gives us a much better idea. And all it is an app, just like we have on our phone for anything else. Some of us may already have an app for our meters that we have that connect via Bluetooth or something like that. It works the same exact way. That's the nice part about it. All right, so let's quickly watch a video about how to apply our Freestyle Libre sensor. So we're going to get this pulled up, and we're going to get started.
I knew I wanted to be a designer. I really love making homes come to life. I work at my clients' homes quite a lot, and I was uneasy about pricking my finger and checking my glucose around them. I'd have to find someplace private. Now, since I use the Freestyle Libre 2 system, I don't worry about any of that. I can check my glucose with a discreet scan, without anyone even knowing. It's easy to put on a new sensor.
Here's how Sarah puts on a new sensor. Select the site on the back of your upper arm, where you will clean it and let it dry. The Freestyle Libre 2 sensor kit comes in two parts, the sensor applicator and the sensor pack. It also contains an alcohol wipe and product insert. Peel the lid completely off the sensor pack and unscrew the cap from the sensor applicator. Place the sensor applicator into the open sensor pack and line up the dark mark on the applicator with the mark on the pack. Then press down firmly on the sensor applicator until it comes to a stop. Simply place the sensor applicator over the site you cleaned with the alcohol wipe. Push down firmly until the sensor is in place. Make sure the sensor is secure after application. All that's left is to start the sensor. Just press the blue home button to turn on your reader. It's the only button. All other actions are done on the touchscreen. Tap Start New Sensor on the screen. An image of a hand holding the reader next to a sensor on the arm will appear. Hold the reader within 4 centimeters of the sensor to scan it. If sounds are turned on, the reader beeps when the sensor has been successfully activated. Sarah can get her glucose reading in an hour, and the sensor is discreet. It's similar to the size of a £2 coin. It's water resistant, so you can swim, shower, or exercise. The Freestyle Libre 2 system liberates you from the hassles of routine finger pricks. Why prick when you can scan?
And that's it, just like that. That's all there is to it. And so I know it's kind of hard to believe, but that really is how it works. So let's pull up. We're going to pull up their website here and look at their products. So you can see here we're doing the scan just like we talked about. So this is taking their cell phone. So this young lady's out for a jog, and so she's out going for a run, and maybe going for a walk, and she's outside and wants to see where her blood sugar, her glucose reading is, and so it is taking that phone and bumping against that sensor just like we talked about. All right. And so if you go to their website too, you can actually see a little bit of, you can see some more information about it. And so I'm also going to show you this video real quick about the difference between the blood glucose that we do when we prick our finger, and then also whenever we what it's doing with the sensor. So it works a little different. And so we're gonna watch that now too.
Most of the time, glucose levels in the ISF and the whole blood are similar. However, when the glucose is changing rapidly, such as after meals, after insulin, or after exercise, the glucose level in the whole blood is not the same as glucose in the ISF. This difference in the rate of change is known as the lag. A train is a good way to illustrate this concept of lag. Think of blood glucose and ISF glucose as the cars of a train. In the front car of the train is blood glucose, or BG. In the back of the train is the ISF.
And so what they're talking about here is the blood glucose and the ISF. So that's our interstitial fluid. So that's where this little sensor is reading. So what it's going to talk about is there's a little bit of a lag in between the blood sugar and for the sensor reading. And so so that's what it's going to talk about here in just a sec. So it may be where, so like I said, you prick your finger after you eat a meal or something like that, there might be a slight difference in what the meter or the sensor is saying to what your blood sugar is saying, because it does take a little bit of time for that to happen. It varies from person to person. It's just if it's rising quickly after a meal, it's hard to sometimes it's having that lag to kind of catch up with it. And it's going to illustrate that here in just a second.
SF, or sensor glucose, SG. Imagine that the hills and bumps on the track are like the changes in your glucose levels throughout a typical day. In the front car of the train is blood glucose, or BG. As carbohydrate is digested, glucose enters the bloodstream first before it is absorbed into the interstitial fluid. So blood glucose is in the front of the train. In the back of the train is the sensor glucose, or SG car. Since glucose travels from the blood into the interstitial fluid, sensor glucose follows behind blood glucose. When the train is traveling along a flat plane, when there is little fluctuation in glucose levels, the blood glucose and sensor glucose readings will be very similar, although rarely exactly the same. Now think of going uphill on the train as a rise or upward trend in glucose levels. As the train starts up the hill, you can see that the blood glucose in the front car is leading the sensor glucose in the back car, because changes in glucose appear first in blood glucose. Now, as the train heads down the hill, or glucose is decreasing or trending down, once again, the blood glucose leads in the front car. So, as you can see, whether glucose levels are trending up or trending down, blood glucose leads sensor glucose. There will be a bigger difference in blood glucose and sensor glucose readings on the bigger hills, or when glucose is changing more rapidly, after food, after insulin, and after exercise. There are a couple of important things to keep in mind. When glucose levels are generally stable, expect to see small differences in blood glucose and sensor glucose. However, when the glucose level is changing rapidly, expect to see bigger differences between the blood glucose and sensor glucose readings. It's important to note that with CGM, the focus is not only on the glucose reading at any single point in time, but also on the trend.
So that was a really good point there, right there at the end. The trend is what's important. So we want to see if it's rising. And so even the sensor can notify us that there is a trend that is going the wrong direction. So if there's a trend happening, it's important that we are knowing that the glucose is continuing to rise and it's rising to a dangerous level. So actually, when you're setting up your meter, it will actually let you know when it shows you the symbol, that means you need to check your blood sugar with a prick, because your blood sugar might be very, very high or very, very low, and you need to get an actual reading at that moment. Okay. So you're getting a correct reading. It might just be a little bit behind if there's a large fluctuation. But day to day, if we're doing everything like we're supposed to, we shouldn't see a major difference in between them, just like the video said. So let's talk a little bit more about what these differences are between CGM and blood glucose. So again, you can see we're out in the yard, we're working, nothing major here. So then we can also see by having our phone and having the app, we can look at those trends. So you can actually look on the cell phone here of this gentleman, and he can see where it looks like that was probably after a meal, and you can see where his blood sugar was out of range. So that green section would be what we have considered to be our range, and might have been after a meal. It looks like, based on what we're seeing, that meal might have been a little too high in carbs or high in sugar. Might have had too much dessert. And so it really all depends. All right. So why should you use a CGM? It's continuous glucose monitor. So like we've talked about, you see the full picture. So you're seeing all the trends, the hills and the valleys that you may not get to see on a normal finger prick. In the same vein, no finger prick. You don't have to worry about having to prick your fingers to get the blood sugar readings when you're actually using that sensor. It's reading on a more regular basis for you without you having to really do anything. As long as you're keeping that sensor protected, you're in good shape. You're in control. So a lot of people that use CGM appreciate, and they actually see a difference in how they respond, because they're actually, now that they know the data, they tend to make better choices. So they're making better decisions about what to do with their blood sugar. Okay. So it's and then how it works as well is you're not having to deal with blood. You're not having to deal with the mess that creates, and you're getting those trends. Okay. So going to their website, you can see more of this information. Okay. All right. Again, we're seeing people riding their bikes, doing all kinds of stuff. And they've got a lot of stories on their website of folks that are uh, have used these before. And so I think it's very, very important for you to look at these stories and see. Um, and here's the thing: the biggest thing out of all this is giving it a shot. Okay. So it's very important that you give, uh, if they talk to you about this at the clinic, if you're having to test, if your doctor's telling you that you need to be testing at least 3 times a day, this is important. This is a great option. And so if you're, like I said, if you're with the Langdale Clinic, this is free. There's no reason why you shouldn't try it. And don't be intimidated by the application process. So by putting that device on, like I said, that's the most intimidating part. You kind of get all these supplies that you've never used before, and it's kind of nerve wracking to say, I'm used to doing it this way, and now you want me to completely change it up. Give it a whirl. Let us get you a 3 month supply and give it a shot for 3 months. The thing is, you've always got uh, your your regular blood sugar monitor to fall back on. And you should always still have that with you. But when it comes to day to day, we've got your meter, we've got your uh, continuous glucose monitor. And so the day to day testing that you would normally see or normally have to do, this takes care of that. You don't need near as many supplies. You don't need near as many lancets or test strips because you're not going to need that on a regular basis. If you're doing it like you're supposed to, you really won't need them at all. So that's a big deal, and it can be a life-changing device, and it is for a lot of people. If you go back and look at a lot of the studies, you'll see that most people love this process, because they don't have to prick their finger anymore. That's the biggest thing. But a lot of people liked it from the game. They kind of gamify the process of checking your blood sugar because it's so easy to do now, and you have it on your phone. It's almost like a game to see, can I keep my blood sugar in that green zone, in range? And just like when you're checking your phone, or if you're checking a text message or checking social media, you can go to your app and just bump it against your reader and see where you're at. Get the most recent data, and it collects all that information. It's easy to share with your doctor and then share with us at the pharmacy, and we can help you navigate, okay, why did this meal cause your blood sugar to go so high? Or when you realize maybe your blood sugar dropped too low, and then you can go back and look and say, oh, I may have taken doubled up on my meds and not meant to. Or maybe you're making such improvements that it's time to go to the doctor to maybe change the dose of your meds. If we can see the trends that you're staying too low too often, it might be time to lower the dose, which is what we want. We want to get off all the meds. And if we know all the information, we can get there. So, big thing here, the biggest thing out of all of it, if you take anything away from this, is please try this. If you have questions on how to apply it or anything like that, speak to Dana or Melody or myself, or anyone at the pharmacy when you come by and pick them up. Or if you get home and lay out the supplies and get a little intimidated, that's okay. That's all right. We know where you're at, and we want to help you get through it. So for me, if you give it a shot, give it a whirl. That's what we really want to do here. We want to give this a try and see the difference that it can make for you. So it will be a game changer for you to be able to see all this testing data and be able to do something with it. And the biggest thing I want for you is just to not have to prick your fingers anymore. That's the big thing. That's where I want you to be at. So if you have questions, please reach out, call us at the pharmacy, and we'd love to talk to you. And when you go to your next clinic visit, ask them about CGM or or a continuous glucose monitor, and if your provider think it's right for you. Okay, like I said, give us a shout at any time, and we'll get you taken care of. Thanks, guys.